I will try to give you some future perspectives and a summary of today's presentations. So now we have to admit that molecular testing is a standard of care. It started in maybe sarcomas, lung cancer, breast cancer, but now is expanding to literally every tumor type. We have to make sure, and I'm not talking only for pathologists, but I think for the whole clinical team that takes care of patients and the whole molecular tumor board and clinical tumor board, we have to make sure that we preserve and prioritize tissue for molecular testing, which is sometimes not that easy. So that's why I think trying to envision a more comprehensive perspective of predictive biomarker testing could help. In the case of lung, I think we've seen a very nice examples of how to organize your testing strategy. Upfront NGS makes sense if you consider cost and turnaround time, but there are other options. Sequential testing, maybe real-time PCR could be also a good option in certain regions of the world. And whatever you do, make sure you put the patient in the center of all of your thoughts. So reflex testing and making sure that you integrate also the results from plasma and liquid biopsies is very, very important. Sometimes they are performed in different labs by different people. Sometimes one is an in-house effort, the other one is performed elsewhere. So, but you have to make sure that everything at the end is considered in order to make clinical decisions. And finally, I agree with Herbert. I learned a lot, Alicia, from your talk around the importance of HRR mutations beyond BRCA, which is something that we all have in mind and it's been going on for decades. But it's not only BRCA1 and BRCA2, what's important in prostate cancer, and also MSA high and microsatellite instability. It's a tumor agnostic possibility for all of our patients. I was also very intrigued on how to organize germline and somatic testing. And I think it's good to consider frequencies and have a very well-organized strategy, because you need to probably start considering both in patients with advanced prostate cancer.